What blew my mind when I started to do my research, there are over 100 symptoms that are now attributed to perimenopause and menopause.
This is not a gentle decline. Hormones fluctuate wildly. This is when many women first experience anxiety, brain fog, sleep disruption, weight changes, mood shifts, joint pain, loss of resilience, and that unsettling feeling of, I don't feel like myself anymore.
She is in her mid-40s. She's gaining weight without changing anything she eats, waking at 3 a.m. for no reason, and can't get back to sleep. She is forgetting words mid-sentence. She snapped at her daughter yesterday and cried about it afterwards. Her joints ache in the morning. Her heart races at random moments for no reason at all. She went to her doctor. Her tests all came back normal. She went to another doctor. Same result. She was told to manage her stress. Try yoga. Maybe see a therapist. If any of that sounds familiar, you are not imagining it, and you are not alone. What she was never told, what almost no doctor tells women in their 40s, is that every single one of those symptoms has a name, a cause, and a solution. This is the complete picture nobody gave you. Dr. Mary Claire Haver is one of the most trusted menopause specialists in the United States and the author of The New Menopause. She says something that most of medicine still hasn't caught up with.
It is a full body effect. It's not just hot flashes. It's not just cycle irregularity. We have brain symptoms. We have bone symptoms. We have muscle symptoms. We have gastrointestinal symptoms. There is not an organ system in perimenopause that is not affected by this change.
Full body, every system, brain, bones, muscle, gut, not just hot flashes. That is the picture most women are never given, and it explains why so many feel like they are falling apart in 12 different directions when they are actually experiencing one upstream cause. Estrogen does not just regulate your reproductive system. It has receptors in your brain, which is why declining estrogen causes brain fog, memory lapses, word recall problems, mood changes, anxiety that arrives without a trigger, and sleep disruption that wakes you at 3 a.m. It has receptors in your joints, which is why joint pain and frozen shoulder affect women at dramatically higher rates during this transition than at any other point in their lives. It supports muscle mass, which is why your body composition changes even when you eat and exercise exactly as you always have. Muscle declines. Fat redistributes toward the abdomen. The scale barely moves, but the body completely changes. It regulates the microbiome of your skin, your gut, your oral cavity, which is why your hair changes texture, your skin becomes drier, your teeth become more sensitive, your digestion shifts in ways that seem completely unrelated to each other. They are not unrelated. They are one hormonal shift expressing itself in every system that depends on estrogen, simultaneously. This is perimenopause, and it can begin up to 10 years before your periods become irregular, which is why so many women in their late 30s and early 40s are told they are too young, when hormonally, they are absolutely in it. Here is what tends to make women most angry when they finally understand what was happening. It is not that the symptoms were difficult. It is that they spent years, sometimes decades, being told the symptoms were normal, or stress, or getting older, or a personality issue, or something to manage with antidepressants and yoga. Millions of women have been prescribed antidepressants not because they had depression, but because their estrogen was declining and nobody connected the two. Tamsin Fadal is an Emmy award-winning journalist who spent 30 years as a news anchor. Here is what she was going through on air without a single person around her able to name it.
And I had dark days and I didn't know what they were from. And I'm like, is it my relationship? Is it my job? Is it my not knowing what I'm doing? Like what was going on?
Is it my relationship? Is it my job? One of the most accomplished women in American journalism, questioning everything about herself because nobody gave her the map. Understanding what is happening is the first step, but information without action is just sadness. So here is what the evidence actually says about what to do. Talk to your doctor about HRT, hormone replacement therapy, specifically transdermal estradiol and micronized progesterone. It addresses the upstream hormonal decline that is driving all of it simultaneously, not just hot flashes. The brain symptoms, the sleep, the joints, the body composition, the mood. Women who begin hormone therapy in the perimenopausal window show measurably better outcomes across every system we just discussed. Ask your doctor for these 2 by name. Next, do strength training 2 to 3 times a week. It protects and rebuilds the muscle mass that estrogen used to protect. This is not about aesthetics. Muscle is your metabolic engine and your longevity foundation. Strength training is the most important lifestyle change you can make in this decade. Eat more protein, significantly more than you think you need. Most women are eating 50 to 60 grams a day. The research says you likely need 80 to 120. Start with 30 grams at your first meal. That one change alone begins to shift body composition. Finally, treat sleep as medicine because it is. One bad night of sleep raises cortisol and insulin the following day, compounding every other hormonal challenge. Sleep is not optional. It is as important as anything else on this list. And most importantly, find a provider who understands perimenopause, not a generalist who will tell you you're too young. A menopause-trained clinician who will look at your complete symptom picture and take it seriously. Menopause.org has a certified practitioner directory. Telehealth platforms like Alloy, MidiHealth, and Evernow are online, accessible, and many accept insurance.
Gaining weight, not being able to figure it out, brain fog. Between sleep and brain fog, just those 2 can make you feel so lost.
So lost. That is the word. Not sick, not broken, just lost. Because nobody gave you the complete picture. Until now. Over 100 symptoms are attributed to perimenopause. Most women are told about 3. The woman who spent years going from doctor to doctor, being told her tests were normal, being prescribed antidepressants for hormonal fluctuation, being told she was too young, being told to manage her stress. She deserved better than that. So do you. This is not about getting older. This is about getting the information that was always yours to have. Share this with a woman in your life who has been told everything is normal when she knows something is wrong. Because she is out there, and this is what she needs to hear. Subscribe because every week we go deeper into what is actually happening in your body and what the evidence says about how to support it. You are not falling apart. You are navigating a transition that nobody prepared you for. And now you have the complete picture. We will see you next week.